assessment.
Thank you. Yeah, I'm just going to give you kind of a quick update. I can't do justice to the amount of work that's been done by Dr. Amy Blue, who's at the Medical University of South Carolina, and Ben Cheslock, who actually is also part of the IPP. So there's a nice some synergy here. I'm also going to tag Mary Joan, who was very kind to come to the meeting. Where is Mary Joan? Thank you. This work was funded by the RWJ Foundation, and essentially what we've been doing over the past year under the leadership of Dr. Blue and Cheslock was really looking at what's been done around assessment for interprofessional education. That was the framing. So Amy and Ben conducted a series of interviews with thought leaders. I conducted 20 interviews totals and then did kind of a best evidence synthesis, looking at reviews that have been done. There's been a couple nice reviews done in this area, as well as looking at other literature. The kind of output of that work found that the good news is that all of the studies are relatively small with relatively small samples, and there's only a few of them. The effects of IPE in interprofessional care look promising, that the effects were positive in the few studies that were reviewed and done with some methodologic rigor. There is still a fair amount of gaps, as you might expect in assessment. Most of the work has been done at the individual level, looking at methodologies to measure what the individual takes from the interprofessional educational experience. Most of those tools have focused on, you might imagine, knowledge and attitudes, important, less around behaviors. That work is coming. There has been some behavioral work using things like standardized patients, some direct observation. There are some tools that have been developed and, again, show promise. Part of the challenge with many of these tools is that a fair amount of the work was not guided by theory, and so that's something that has been recognized as a need moving forward to make sure this kind of work is kind of theory-driven. There has been some work done at the team level. Again, less so. That tends to be using standardized patients have been where most of the studies have done, less so within the workspace. And probably a gap that's going to need a fair amount of attention is what does this mean at the institutional level when you think about interprofessional education. So the kind of output of that was encouraging, still a ways to go, but there's clearly work that's ongoing. Amy and Ben are putting together a report that will be published and also kind of synthesize exactly where we are at the current time. So that's very exciting. So I'm going to stop there. And Mary Joan, is there anything you want to add to that from your experience being at the February kind of meeting? We were fortunate to have a lot of really smart people there to help us think through the findings.
Certainly nothing more about the results. I thank the team at ABIM and Amy Blue. And this work was really intended to inform the work of the National Center so that they could take it to the next level. So thank you.
Yep, thank you for that. Right, yeah, Barbara Brand, as you know, is heading the Center at University of Minnesota. So that was the primary purpose. Great. Okay, thanks.
So Eric's going to stay here with Jody. Yeah.